along those lines, and I'm glad I've got you here for this today, Doc, because we've got a lot of medical stories this week. I don't know, it was serendipity if the world knew that you were going to be on our panel today and blessed us with this degree of let's say medical fuckery that we have to talk about. And we're gonna talk about RFK and the CDC. So I've got a bevy of stories here, and the first one, hey, let's making measles great again, right? So U.S. hotspots are seeing more measles cases as the national total nears 2,000. The U.S. is on the brink of losing measles elimination status with over 1,900 cases recorded this year, just 1 month shy of the 2,000 case threshold, and that includes 46 new cases in the latest update. Measles, highly virulent. I'm sure you can tell us, Doc. It spreads rapidly. If it is in your area, you are going to get it unless you're vaccinated. So this is spreading almost entirely through outbreaks, 49 outbreaks in 44 jurisdictions, accounting for 88% of all cases. An additional 24 cases involve international visitors, underscoring how porous this thing has become. This is an overwhelmingly vaccine-preventable crisis. 93% of the cases are among unvaccinated people or those with unknown vaccination status. Only 4% of patients were fully vaccinated. Children are bearing the brunt, with 2/3 of cases under age 20, with significant spread in elementary schools tied to low vaccination rates. So far, 222 people have been hospitalized, with 3 confirmed deaths. Sticking on CDC news and vaccinations and what have you, the Centers for Disease Control and Prevention have ended recommendation for all U.S. newborns to receive the hepatitis B vaccine. The CDC ended its 30-year recommendation for universal hepatitis B vaccination at birth, now limiting it to infants whose mothers test positive or whose status is unknown. This shift follows pressure from Health and Human Services Secretary Robert F. Kennedy Jr. and his vaccine advisory panel, and reframes routine vaccination as individual-based decision-making, pushing parents to decide with their doctor instead of following clear public health standards. Public health experts are alarmed, warning the change will increase preventable childhood infections, create confusion, and reduce vaccine uptake by weakening insurance coverage and clinical guidelines. This ends a proven successful program. Hepatitis B infections dropped nearly 90% after universal infant vaccination was introduced. Critics say the CDC is abandoning science in favor of anti-vaccine ideology, signaling a broader retreat from evidence-based public health under Kennedy's influence. I've got a couple more medical stories, but I want to pause there and talk about these, because these, I think, form a pair. How do medical professionals navigate a world where the CDC itself is not giving proper guidance?
Yeah. I mean, I haven't pulled out all my hair yet, but this is crazy stuff. Personally, I took care of a little girl with measles encephalitis at Denver General Hospital in 1975. It turns out there are not that many doctors still practicing who have seen and taken care of measles cases. And in 1975, I saw this little girl, and her face was just kind of twisted up, and I can only imagine it must have been beautiful. And she was twitching, she had seizures, and our team in the pediatrics ward there diagnosed her with measles encephalitis, which would not be fatal, but would leave her with permanent brain damage. And then, the measles vaccination had come out in 1969 or something like that. There was still measles in the United States in 1975, but the vaccine was incredibly successful at stopping measles, because measles is incredibly infectious disease. If a measles patient walks through a room, the virus can stay in the air for 2 hours. 9 out of 10 people who come into contact with a person who's been infected, they'll get measles if they weren't vaccinated. So it's just incredibly, incredibly infectious, and it's incredibly dangerous. For many years before we made a huge progress against measles around the world, it was one of the leading causes of death in the developing world, because children who get measles who are at all malnourished are then at very high risk for the consequences of really serious illness and death. But even in Indiana, there were 8 cases in Indiana up around Fort Wayne that were reported in August, September. And I don't have recent data on what happened in that part of the state, but they were in religious communities that didn't vaccinate. And kids have been hospitalized. With this outbreak, several children have died, and now we're seeing these outbreaks. It was the worst of it was in Texas, and now we're seeing these outbreaks in South Carolina and just different states, and it's likely to just get worse. So measles by itself is just a hugely important issue for the United States and for the world, and for parents and for children and for all of us. And so, again, rein me in if I get going too long, but so there was a study published in the kind of the premier British medical journal called The Lancet years and years ago, that they linked measles vaccination with autism. And then that study was completely debunked. It was withdrawn, retracted. It was proven to be completely wrong. And the methodology, it was just, made up bullshit. But that guy, Andrew Wakefield, who published that study, still manages to get his way into things and get onto podcasts. And he continues to support himself financially by pushing this forward. And then, as an interesting thing right now, lately, RFK has been talking about looking at the vaccination standards in Denmark. And Denmark's a really interesting country for vaccinations, because they have been the source of a lot of what we know about vaccinations, because they've got a national health program. So everybody is enrolled and they can study everybody pretty well. And 20 years ago, they put out the definitive study where they looked every single child growing up in Denmark, and when they got vaccinations, and if and when autism spectrum was diagnosed, and there was no correlation between measles vaccine and autism, and that was a long time ago. So that's measles, and I could go on and on. Hepatitis B, likewise. I've got personal connections to hepatitis B. But the most important thing to understand about hepatitis B is that it is much more common. It is endemic in Asia, China, Taiwan, Malaysia, and that part of the world. And so hepatitis B is very common there, and it is the #1 cause of liver failure and liver cancer. And it's a huge cause of problems in the United States as well, but it's really the tragedy of hepatitis B, particularly in Southeast Asia, and then the triumph of getting people vaccinated. And it is so it has been so gratifying to see hepatitis B. You mentioned it, down by 90%. The problem with hepatitis B is that it is not passed through the placenta from mother to child, but it can be passed as the child goes through the birth canal. The child can get infected with hepatitis B right there, right then. And so that's why we give hepatitis B to children in their first day or two of life. And it's been incredibly effective. Just that one shot right at birth seems to almost completely prevent the risk that that child had hepatitis B transmitted to it. Now, in Denmark, they don't give hepatitis B to newborns. And the reason is because they test 99.9% of their mothers during their prenatal period to see if they have hepatitis B, and they only vaccinate the ones who are not carriers of hepatitis B. So that's a reasonable strategy if you've got a 99% test rate for hepatitis B during pregnancy. But I think everybody listening here has not missed the fact that Indiana, for instance, has some of the worst infant mortality data in the country. And something like 18%, well, I don't know about the Indiana data, nationally, about 18% of women do not get hepatitis B testing during pregnancy because we do such a terrible job of providing health care to pregnant women. And so in the United States, it makes absolute sense. I saw a statement from one of the public health leaders in Denmark yesterday he said, we don't understand why people in the United States wouldn't want to give hepatitis B at birth because their system, misses a lot of people. We don't have to do that, but it's not because we're worried about side effects of hepatitis B. It's just a matter of simple cost efficiency. If you've got a really well-functioning system that tests everybody, then we can focus where we spend our money and just vaccinate the people who need it. But the United States doesn't have that luxury. But they didn't stop doing it in Denmark because of risk of side effects, because there are none. It was just a different way to manage their population health.
Well, right, because they have that universal healthcare system, so they can catch these things up front. Because people, aren't like worried about co-pays and stupid crap just to get their routine prenatal care. They can catch those things up front. We have a lot of people fall through the cracks beforehand, and then or have to do things on the back end to catch it. I want to move on to another medical story, and I will let Derek and Maria get in here shortly. But so also this week, we saw the Trump administration move to cut off transgender care for children, moving to effectively eliminate gender-affirming care for minors by proposing to cut off Medicaid, Medicare, and CHIP funding to hospitals that provide it. Again, RFK framed gender-affirming care as malpractice, directly contradicting every major U.S. medical association that supports evidence-based treatment for transgender youth. This threat isn't just symbolic, because nearly all U.S. hospitals rely on federal health funding. The rules would functionally ban care nationwide, even in states where it remains legal. They're using market pressure and threats of withholding funding to hospitals in those areas. The proposals aren't final yet, but they are already chilling care, with providers pulling back in anticipation of federal retaliation and lawsuits looming. This is part of a broader federal crackdown on transgender rights, including redefining sex in federal law, excluding gender dysphoria from disability protections, and criminalizing providers. Now, again, Doc, the medical associations, the AMA and the American Academy of Pediatricians, both say, yes, kids with gender dysphoria should receive gender-affirming care. But they, RFK and his ideological allies, don't seem to care about what the actual doctors say. They're driven by their extremism. Do I read that correctly?
Yeah. It's still another horrible politicization of very complex personal health and emotional decision making, and the fact that trans people have been picked out now and brought into such a horrid situation of, I don't know, somehow people feel like they can make fun of trans people, they can hate trans people, they can discriminate against trans people. And and they can, raise money against trans people, on and on and on. It's terrible. It's awful. It's horrible. And so the care for trans people is really tricky. It's tricky from a medical perspective. When do you treat with what? But for a family, for parents and children in particular, it's really complicated. And particularly a lot of the people who really come to their gender awareness as adolescents, it's a really tough time in life just to start with. And this just makes, and everything to do with sexuality is really tough. And this stuff makes it crazy. I mean, I just know numbers of people who say this issue alone is the most likely thing to cause them or their children to leave this country, because they just don't feel safe here. And I know pretty well a couple doctors who practice gender affirming care in Monroe County in Bloomington, and it's and I just honor their bravery and their courage to do this, because I'm sure it's not an easy thing for them. But my heart just goes out to the people involved, and at the same time to be making these grand statements that it is wrong, it's malpractice to treat these people. Is that itself is malpractice to say something like that. I mean, that's just so irresponsible. And we're talking about less than one child in 1,000 has significant issues with gender dysphoria. So that is, on the one hand, not a tiny, insignificant in any way, a very significant percentage of people, but it's not like it's everywhere either. So these are people who are in unusual circumstances, who really need to be cared for in as holistic and loving and caring a way as possible. And they don't need this other noise and fear and craziness on the outside, just making things worse.
Yeah. Maria, I'm looking at this and the vaccine stuff and all of it, and I'm seeing the typical Republican anti-science rhetoric. They don't seem to care what doctors say, what public health officials say. These people think public health is communism and everything should be made at an individual level, and they either don't understand or refuse to understand that certain things have to be done collectively. Am I reading that right?
Yeah, you're reading that right. And it is stunning, how people just do not pay attention, to the data. The amount of self-harm, the amount of suicides that are, I mean, this brings me back to, what I said earlier in terms of what we can control, right? We can control not ostracizing people who are transgendered. We can choose to not, we can choose to not spend time and energy and money on fighting people being people. What this administration and what some people choose to spend their time and energy on is stunning. And I always ask myself, what is at the root? Because I like I said at the top of the show, I'm about the root causes of things. I don't like to spend time and energy on band-aids, right? On treating the symptoms. And now it takes all work, right? It takes everybody, all work at all levels. But I just feel like, our time and energy could be spent in such a more economical ethical, just way. I asked myself, what's the fear? What are you afraid of? Because fear drives most people's behaviors who behave in that way. And then also who benefits, right, is something that I ask as a person of color as well. Who's benefiting from these conversations and from the, so it is just stunning. I'll just say it, that the money, time, and energy resources are wasted in this way.
Yeah. So, hey, listen, though. Somebody out there gets that RFK needs to go, and maybe from an unexpected place. So, this is actually from News Nation, of all places. Mike Pence's conservative group is demanding Trump fire RFK Jr. Oh, is it because he's bad for public health? No, it's because he's failed to review the safety of mifepristone, despite promising to do so at his confirmation hearing. See, the complaint isn't that RFK is too extreme, it's that he isn't too extreme enough. Anti-abortion groups want stricter controls or rollback after the FDA approved a generic version of the drug. Pence's allies argue RFK ignored data and blocked oversight, framing the issue as regulatory failure rather than ideological disagreement, exposing a crack inside the Trump coalition. RFK Jr.'s anti-vax crunchy contrarianism doesn't line up cleanly with the religious rights abortion absolutism. Derek, it's like Godzilla, right? Let them fight.
Yeah, you can let them fight, but I mean, Pence has shown his backbone a couple times. He's GOP. Yes, he is horribly religious. But, he still fights for what he believes is right for this country. And, sometimes that lines up with common sense sometimes.
Broken clocks right twice a day, right?
Exactly. So, I mean, I kind of give him props on saying that, RFK Jr. is a idiot, but like you said, I've given him props twice in my life. And that was January 6th and this. So
yeah. These splits in the coalition surprise. About that, so one more I point out here in the healthcare field, right? So House Republicans passed a symbolic healthcare bill that dodges the real crisis. Their package offers conservative tweaks, but does nothing to stop the ACA premium subsidies from expiring at the end of the year, which will spike costs for 22 million Americans. Leadership under Mike Johnson refused to allow a vote on extending the subsidies, triggering a rare revolt for moderate Republicans. And the word moderate is doing a lot of work there. Moderate is working so hard there, it must be an immigrant. So these four Republicans joined Democrats on a discharge petition to force a House vote on a 3-year extension. Now, Mike Johnson's running out the clock, delaying this vote into January, even though these subsidies expire at the end of December. A choice the Democrats and those moderates say guarantees immediate harm to constituents, right? There's at least 1 month of giant insurance spikes if nothing is done. So the earliest, if this thing passes in January, that they could lower prices, that they could put these subsidies back in place, would be for February. Again, these quote-unquote moderates openly blame their own leadership, saying that doing nothing is worse than a flawed extension, and accuse the speaker of late, unserious policymaking that leaves families exposed to higher premiums. The path forward is procedurally messy and politically volatile. A forced House vote could pressure the Senate into a bipartisan compromise, but GOP leadership is still trying to peel moderates away and avoid owning the fallout. Again, Dr. Rob, all of this is failing to deal with the problem the right way, and that is a national health care program.
Where to start? Yes, because we have this patchwork quilt, torn and tattered patchwork quilt of healthcare coverage things, and it's all relates internally and in all these complicated ways and causes huge inefficiency. And just as we see, so this little side thing, which I feel like I understand health policy pretty well, and health politics still bewilder me after years of trying to understand it. But how it was that during COVID, the Biden administration gave some extra juice to the Affordable Care Act, subsidies that are given to help people who get coverage through the Affordable Care Act afford their premiums. And because the government subsidizes part of their premiums, so they gave a little boost to that during COVID. And they did all sorts of things during COVID to expand public health in ways that probably saved millions of lives. But this particular little piece of it was something I didn't even pay any attention to at the time. And although my kids are mostly covered under Affordable Care Act marketplace plans. And so now my kids are facing these incredible increases in their premiums. So now getting back into these interlocking pieces here. So 24 million people are going to see their health insurance premiums rise significantly, maybe at a minimum 15%, 15%, at a maximum 200%. And maybe that's not even the maximum. So what's going to happen is, of these millions, tens of millions of people, they're going to start getting these bills that are way more than they've been paying. And they're already squeezed because of the economy. They're already squeezed by inflation at the grocery store. But here we're talking about levels of inflation way higher than 4 or 8% increases in groceries. And so what are people going to do? The sickest people are, and they know who they are. They're gonna figure out some way to keep their coverage, and the less sick people, of course, they only believe they're less sick. They don't really know whether they're going to fall on the ice tomorrow morning or have a heart attack next week or be diagnosed with uterine cancer in 3 weeks. But those people are going to say, "Oh my gosh, I've just got to take this crazy chance and either drop my coverage completely or jack around with getting the least expensive premium policy, which then is going to have the highest copays and deductibles and stuff." And so one of the ways then that's going to be like ripples going out is that people covered under these plans are going to end up being sicker. And that's going to end up meaning that the insurance companies are going for everybody, not just insurance companies covering people in through the marketplace, but the insurance companies covering everybody who's got employer-based insurance are raising their rates because they're expecting that the general pool of people getting covered is going to be sicker and therefore more expensive. And it just kind of goes on and on.
It's all a patchwork, right? And like you said, we have to address this thing at the root issue. We need a national health program if we're going to get through this thing. And the reason Republicans cannot come up with an alternative to the ACA is because it was kind of their idea. This is the Republican health plan. Obamacare originated with the Heritage Foundation, and we'll see. That's why we need to keep propping it up and doing things like this. I mean, listen, a lot of Democrats aren't going to like this. ACA kind of sucks. It was always a half measure. And if we don't do Medicare for all or something like it, we're going to keep running into problems like this.